Question 1. The control framework reveals that certified rehabilitation counselors are tasked with integrating evidence-based mindfulness and stress reduction techniques into client care. A counselor is working with a client who has a recent diagnosis of a chronic illness and is experiencing significant anxiety and sleep disturbances. The counselor has extensive personal experience with a specific guided meditation technique that has proven effective for them. Considering the client's presentation, which of the following represents the most ethically sound and professionally effective approach to introducing mindfulness and stress reduction? Option A. Implement a standardized stress reduction protocol designed for individuals with chronic illnesses without first assessing the client's individual needs, preferences, or potential contraindications. Option B. Focus exclusively on the counselor's personal experience with a specific guided meditation technique, explaining its benefits in detail and encouraging the client to adopt it as the primary stress reduction strategy. Option C. Immediately recommend a popular mindfulness app that the counselor has found personally beneficial, assuming it will be effective given the client's symptoms. Option D. Conduct a thorough assessment of the client's current anxiety levels, sleep patterns, readiness for new coping strategies, and preferences regarding different types of relaxation techniques. Then collaboratively develop a plan that may include mindfulness or other stress reduction methods. Correct answer is D. Conduct a thorough assessment of the client's current anxiety levels, sleep patterns, readiness for new coping strategies, and preferences regarding different types of relaxation techniques. Then collaboratively develop a plan that may include mindfulness or other stress reduction methods. Explanation. The control framework reveals that certified rehabilitation counselors, CRC, are expected to integrate evidence-based practices into their client care. When implementing mindfulness and stress reduction techniques, a key challenge lies in tailoring these interventions to the unique needs, cultural backgrounds, and cognitive capacities of individuals with disabilities. This requires a nuanced understanding of how different conditions might impact a client's ability to engage with or benefit from specific techniques, and the ethical imperative to avoid imposing a one-size-fits-all approach. The correct approach represents best professional practice because it prioritizes a client-centered, individualized assessment and collaborative goal-setting process. This aligns with the ethical standards of the CRC profession, which mandate that counselors respect the dignity and welfare of their clients. By assessing the client's readiness, preferences, and potential barriers, and then co-creating a plan, the counselor ensures the intervention is not only appropriate but also empowering for the client. This respects client autonomy and promotes engagement, which are critical for successful rehabilitation outcomes. Furthermore, this approach is consistent with the principle of informed consent, ensuring the client understands the proposed techniques and their potential benefits and limitations. An incorrect approach that involves immediately prescribing a generic mindfulness app without prior assessment fails to uphold the ethical duty of competence and diligence. It bypasses the crucial step of understanding the client's specific needs and potential contraindications, potentially leading to ineffective or even detrimental outcomes. This could be seen as a violation of the counselor's responsibility to provide services that are appropriate and beneficial. Another incorrect approach, focusing solely on the counselor's personal experience with a particular technique without considering the client's individual circumstances, demonstrates a lack of client-centered practice and potentially a failure to maintain professional boundaries. The counselor's personal preferences should not dictate the therapeutic direction without a thorough assessment of the client's needs and suitability. This could be an ethical lapse in objectivity and client welfare. Finally, an approach that assumes all clients with similar disabilities will benefit from the same stress reduction technique, without individual assessment, ignores the diversity within disability groups and the principle of individualized service delivery. This can lead to misapplication of interventions and a failure to meet the client's unique rehabilitation goals, potentially violating the counselor's duty to provide competent and appropriate services. The professional decision-making process for similar situations should begin with a thorough client assessment, encompassing their disability, personal history, cultural background, cognitive abilities, and expressed preferences. This should be followed by a collaborative discussion about potential interventions, including mindfulness and stress reduction techniques, explaining their rationale, potential benefits, and limitations. The counselor should then co-create a treatment plan with the client, ensuring it is tailored to their specific needs and goals, and regularly evaluate its effectiveness, making adjustments as necessary. This iterative, client-driven process ensures ethical and effective service delivery. Question 2. Implementation of a comprehensive rehabilitation assessment involves integrating various data points to inform the development of an individualized plan. Which of the following best represents a best practice approach to synthesizing client information for rehabilitation planning? Option A. Prioritizing standardized assessment results over client self-report to ensure objectivity. Option B. Focusing exclusively on the client's stated vocational preferences, regardless of assessment outcomes. Option C. Developing the rehabilitation plan solely based on the counselor's professional judgment without client input. Option D. Collaboratively integrating client self-report, standardized assessment findings, and counselor observations to inform the plan. The correct answer is A. Prioritizing standardized assessment results over client self-report to ensure objectivity. Explanation. Scenario analysis. This scenario presents a common challenge in rehabilitation counseling, where a counselor must balance the client's expressed desires with objective assessment data to formulate an effective rehabilitation plan. The professional challenge lies in ensuring the plan is both client-centered and grounded in evidence-based practices, adhering to ethical guidelines that prioritize client autonomy, while also ensuring professional competence and client welfare. The counselor must navigate potential discrepancies between the client's self-perception and the findings of formal assessments, requiring careful communication and collaborative decision-making. Correct approach analysis. The correct approach emphasizes a collaborative process where the counselor integrates the client's self-report, the results of standardized assessments, and observations from the counseling relationship. This aligns with best practices in rehabilitation counseling, which mandate a comprehensive assessment that considers multiple sources of information. The Rehabilitation Act of 1973, as amended, and the ethical codes of professional organizations like the Commission on Rehabilitation Counselor Certification, CRCC, underscore the importance of individualized plans for employment and other rehabilitation goals, developed in collaboration with the client. This approach ensures that the plan is realistic, addresses the client's unique needs and strengths, and is supported by objective data, thereby maximizing the likelihood of successful outcomes and promoting client self-determination. Incorrect approach is analysis. One incorrect approach involves solely relying on the client's self-report without incorporating objective assessment data. This fails to meet the professional standard of a comprehensive evaluation and could lead to an unrealistic or ineffective rehabilitation plan, potentially violating ethical principles of competence and client welfare by not fully understanding the client's vocational aptitudes or limitations. Another incorrect approach is to disregard the client's expressed preferences and solely base the plan on assessment results. This undermines client autonomy and the principle of self-determination, which are cornerstones of ethical rehabilitation counseling. Such an approach can lead to client disengagement and resistance, as the plan does not reflect their personal values and aspirations. A third incorrect approach is to select a rehabilitation goal that is not supported by any assessment data, even if the client expresses interest. This demonstrates a lack of professional rigor and a failure to apply evidence-based practices. It could lead to a plan that is not feasible or sustainable, ultimately failing to serve the client's best interests and potentially violating ethical standards related to professional judgment and accountability. Professional reasoning. Professionals should employ a systematic, multifaceted approach to assessment. This involves 1. Establishing rapport and actively listening to the client's perspective and goals. 2. Administering and interpreting appropriate standardized assessments to gather objective data on vocational interests, aptitudes, skills, and limitations. 3. Observing the client's behavior and engagement during the counseling process. And 4. Collaboratively synthesizing all gathered information with the client to develop a mutually agreed upon, individualized rehabilitation plan that is both aspirational and achievable. This process ensures adherence to ethical mandates and best practices for client-centered care. Question 3. Risk assessment procedures indicate a client has expressed a strong vocational goal of becoming a software engineer. However, their current functional assessment reveals significant challenges with fine motor control and sustained attention. Considering the definition and scope of rehabilitation counseling, which of the following approaches best addresses this situation? Option A. Immediately inform the client that their stated vocational goal is not feasible given their current functional limitations, and suggest a more readily achievable vocational path. Option B. Collaboratively explore the client's interest in software engineering by investigating potential assistive technologies, adaptive strategies, and alternative roles within the tech industry that may align with their current functional capacities and interests. Option C. Accept the client's stated vocational goal without further assessment of its feasibility, assuming that the client's motivation will overcome any functional challenges. Option D. Focus solely on the client's current functional limitations and develop a vocational plan that addresses only those areas where they demonstrate immediate proficiency, without further exploration of their stated aspiration. The correct answer is B. Collaboratively explore the client's interest in software engineering by investigating potential assistive technologies, adaptive strategies, and alternative roles within the tech industry that may align with their current functional capacities and interests. Explanation. Scenario analysis. This scenario presents a common challenge in rehabilitation counseling where a client's stated vocational goal may not align with their current functional capacities or the available resources. The counselor must navigate the client's autonomy and self-determination while ensuring the plan is realistic, achievable, and promotes successful reintegration. The challenge lies in balancing advocacy for the client's aspirations with the ethical and professional responsibility to provide guidance grounded in evidence and practical considerations. Correct approach analysis. The correct approach emphasizes a collaborative and iterative process. It involves a thorough assessment of the client's current functional limitations, skills, interests, and the availability of assistive technology and support services. This aligns with the core principles of rehabilitation counseling, which prioritize client-centered care, informed consent, and the development of individualized plans. The scope of rehabilitation counseling, as defined by professional standards and ethical codes, mandates that counselors work within the client's capabilities and available resources to achieve meaningful outcomes. This approach respects the client's right to self-determination while ensuring the plan is grounded in reality and promotes successful outcomes. Incorrect approaches analysis. An approach that immediately dismisses the client's stated goal without further exploration fails to uphold the principle of client self-determination and may be perceived as paternalistic. It neglects the counselor's responsibility to explore underlying motivations and potential modifications to the goal. This could violate ethical guidelines that require counselors to respect the dignity and worth of clients and to foster their autonomy. An approach that solely focuses on the client's limitations without exploring potential supports or adaptations overlooks the rehabilitative aspect of counseling. The definition and scope of rehabilitation counseling include identifying and utilizing resources to overcome barriers. Ignoring these aspects can lead to a plan that is not truly rehabilitative and may prematurely limit the client's opportunities. This could be seen as a failure to provide comprehensive services as expected within the profession. An approach that prioritizes expediency over thoroughness by accepting the goal without a comprehensive assessment of its feasibility risks developing an unrealistic plan. This can lead to client frustration, disappointment, and a lack of progress, ultimately undermining the effectiveness of the rehabilitation process. It may also violate ethical obligations to provide competent services and to ensure that interventions are evidence-based and tailored to the individual. Professional reasoning. Professionals should engage in a systematic process that begins with active listening and validation of the client's expressed desires. This is followed by a comprehensive assessment that includes functional capacity, vocational interests, transferable skills, environmental factors, and available resources. The counselor then collaborates with the client to identify potential barriers and develop strategies to address them, which may involve modifying the goal, seeking assistive technology, or developing new skills. Throughout this process, informed consent and ongoing communication are paramount. The decision-making framework involves weighing the client's aspirations against their current realities and available supports, always striving for a plan that is both meaningful to the client and professionally sound. Question 4. The risk matrix shows a moderate likelihood of the client experiencing a setback if they pursue their stated vocational goal of becoming a freelance artist immediately due to current financial instability and limited professional network. The client, however, expresses strong passion and a clear vision for this goal. As a certified rehabilitation counselor, what is the most appropriate initial approach? Option A. Engage in a collaborative exploration with the client to understand their passion, identify potential barriers to their vocational goal, and brainstorm strategies to mitigate risks and build their network, while respecting their autonomy and self-determination. Option B. Advise the client that the risk matrix indicates their goal is too ambitious at this time, and suggest they focus on a more stable, lower-risk employment option until their financial situation improves. Option C. Immediately implement a structured plan to address the financial instability and network building, presenting it to the client as the necessary steps before they can even consider their artistic aspirations. Option D. Downplay the client's artistic aspirations, focusing solely on the risk assessment and suggesting they explore less demanding vocational paths that align with the matrix's lower risk profile. The correct answer is A. Engage in a collaborative exploration with the client to understand their passion, identify potential barriers to their vocational goal, and brainstorm strategies to mitigate risks and build their network, while respecting their autonomy and self-determination. Explanation. This scenario presents a common challenge in rehabilitation counseling, balancing client autonomy with the counselor's professional responsibility to ensure safety and progress, particularly when a client's stated goals may not align with their immediate well-being or perceived capacity. The risk matrix, while a tool for assessment, should not dictate the therapeutic relationship, but rather inform the counselor's approach. The core of the challenge lies in applying person-centered principles ethically and effectively within a regulated professional framework. The correct approach embodies best professional practice by prioritizing the client's self-determination and inherent worth, central tenets of person-centered therapy. It involves active listening, empathy, and unconditional positive regard to build rapport and explore the client's motivations and barriers without judgment. This aligns with the ethical guidelines for certified rehabilitation counselors, which emphasize client autonomy and the counselor's role in facilitating the client's own decision-making process. By collaboratively exploring the client's goals and perceived obstacles, the counselor empowers the client to identify their own solutions and develop a plan that is meaningful and sustainable for them, fostering intrinsic motivation and long-term success. This approach respects the client's lived experience and expertise in their own life. An incorrect approach that focuses solely on the counselor's interpretation of the risk matrix, overriding the client's expressed desires, represents a significant ethical failure. This would violate the principle of client autonomy, a cornerstone of person-centered therapy and professional rehabilitation counseling ethics. Such an approach risks alienating the client, undermining trust, and creating a paternalistic dynamic that is counterproductive to rehabilitation. It may also contravene specific regulations that mandate informed consent and client participation in treatment planning. Another incorrect approach that dismisses the client's goals due to perceived low likelihood of success, without exploring the underlying reasons or potential for growth, also fails to uphold person-centered principles. This demonstrates a lack of empathy and a premature judgment of the client's capabilities, potentially leading to discouragement and disengagement. Ethically, counselors are expected to explore all avenues with clients and support their aspirations, even if they appear ambitious, by breaking them down into manageable steps and addressing potential barriers collaboratively. A third incorrect approach that involves imposing a predetermined plan based on the risk matrix, without adequate client input or exploration of their perspective, is also professionally unacceptable. This bypasses the essential collaborative nature of rehabilitation counseling and person-centered therapy. It fails to acknowledge the client's unique strengths, values, and preferences, which are crucial for developing an effective and motivating rehabilitation plan. Such an approach can lead to resistance and a lack of commitment from the client, ultimately hindering the rehabilitation process and potentially violating ethical standards related to client involvement in their own care. The professional decision-making process for similar situations should begin with a thorough understanding of the client's perspective, utilizing active listening and empathetic inquiry. The counselor should then integrate assessment data, such as the risk matrix, not as directives, but as information to be discussed and explored collaboratively with the client. The focus should always be on empowering the client to make informed choices about their rehabilitation journey, fostering a partnership built on trust and mutual respect, while adhering to ethical codes and regulatory requirements. Question 5. The evaluation methodology shows that a client with a recent spinal cord injury is experiencing significant adjustment difficulties, including feelings of hopelessness and a perceived lack of control over their future vocational prospects. The rehabilitation counselor is considering which major counseling theory to primarily utilize in guiding their interventions. Which theoretical approach would best align with the certified rehabilitation counselor's ethical mandate to promote client independence, vocational adjustment, and community integration? Option A: a biopsychosocial vocational model that integrates cognitive behavioral strategies with an emphasis on environmental supports and client empowerment. Option B: a strict behavioral modification model focused solely on observable behaviors and reinforcement schedules. Option C: a purely psychodynamic approach focusing on early life experiences and unconscious conflicts related to the injury. Option D: an existential approach emphasizing the search for meaning in suffering without specific vocational or environmental intervention strategies. The correct answer is a biopsychosocial vocational model that integrates cognitive behavioral strategies with an emphasis on environmental supports and client empowerment. Explanation: this scenario presents a professional challenge because the rehabilitation counselor must select a counseling theory that not only aligns with the client's presenting issues, but also adheres to the ethical and legal standards governing the profession. The counselor needs to demonstrate an understanding of how different theoretical orientations conceptualize disability, recovery, and the client-counselor relationship, and how these align with the principles of client-centered care and evidence-based practice as mandated by the Certified Rehabilitation Counselor (CRC) certification standards. The challenge lies in moving beyond a superficial understanding of theories to a nuanced application that respects the client's autonomy and promotes their vocational and personal adjustment. The correct approach represents best professional practice because it prioritizes a theory that emphasizes client empowerment, self-efficacy, and the development of coping mechanisms within the context of the client's environment. A theory that focuses on the interplay between individual strengths, environmental barriers, and societal attitudes towards disability, such as a biopsychosocial vocational model informed by principles of ecological psychology and social cognitive theory, is most aligned with the CRC Code of Professional Ethics. This approach supports the counselor's role in facilitating the client's active participation in their rehabilitation process, fostering realistic goal setting, and advocating for necessary accommodations. It directly addresses the core competencies of a CRC by promoting independence, community integration, and meaningful employment. An incorrect approach that focuses solely on a psychodynamic interpretation of the client's disability without adequately integrating vocational and environmental factors fails to meet the comprehensive scope of rehabilitation counseling. This approach risks pathologizing the client's experience and may not adequately address the practical barriers to employment and community participation, thereby violating the ethical principle of promoting client welfare and independence. Another incorrect approach that relies exclusively on a behavioral modification model, without considering the client's internal experiences, values, and environmental context, is also professionally unacceptable. While behavioral techniques can be useful, a singular focus overlooks the client's subjective experience of disability and their personal meaning-making, potentially leading to interventions that are not holistic or client-centered, and thus not in line with the ethical mandate to respect client dignity and self-determination. A third incorrect approach that adopts a purely existential framework without grounding it in the practical realities of vocational rehabilitation and the specific challenges of disability may also be insufficient. While existentialism addresses meaning and purpose, its application in rehabilitation counseling requires integration with practical strategies for overcoming barriers to employment and social inclusion, which are central to the CRC's scope of practice. The professional decision-making process for similar situations should involve a thorough assessment of the client's strengths, needs, environmental factors, and vocational goals. The counselor should then critically evaluate major counseling theories, considering their underlying assumptions about human behavior, disability, and the change process. The chosen theoretical orientation should be one that is evidence-based, client-centered, and directly applicable to the multifaceted nature of rehabilitation. This involves a continuous process of ethical reflection adherence to professional standards, and a commitment to client advocacy and empowerment. Question 6. Investigation of a rehabilitation counselor's actions when a client with a disability is seeking employment, and the counselor believes specific accommodations are crucial for success, but the client is hesitant to explicitly request them from a potential employer, focusing instead on their general qualifications. Option A. The counselor should discuss with the client the importance of clear communication regarding necessary accommodations and collaboratively develop a strategy for how the client can best articulate their needs to the employer, while respecting the client's ultimate decision on what and how to disclose. Option B. The counselor should directly contact the potential employer and negotiate the specific accommodations on behalf of the client, assuring the employer of the client's ability to perform the job with these adjustments. Option C. The counselor should inform the potential employer about the client's disability and the specific accommodations they believe are necessary, without first obtaining explicit consent from the client to share this information. Option D. The counselor should advise the client to omit any mention of their disability or potential need for accommodations during the initial interview process to avoid potential bias and focus solely on their skills. The correct answer is A. The counselor should discuss with the client the importance of clear communication regarding necessary accommodations and collaboratively develop a strategy for how the client can best articulate their needs to the employer, while respecting the client's ultimate decision on what and how to disclose. Explanation. This scenario presents a professional challenge due to the inherent conflict between a rehabilitation counselor's duty to advocate for a client's needs and the potential for that advocacy to be perceived as overstepping professional boundaries or misrepresenting the client's capabilities to an employer. The counselor must navigate the legal and ethical imperative to support the client's return to work, while also respecting the employer's right to make hiring decisions based on objective qualifications and the client's own expressed wishes and limitations. The counselor's role is to facilitate, not dictate, the employment outcome. The correct approach represents best professional practice because it prioritizes client self-determination and informed consent, aligning with the ethical principles of the Certified Rehabilitation Counselor (CRC) Code of Ethics. Specifically, it upholds the counselor's responsibility to provide accurate information, avoid misrepresentation, and empower the client to make their own decisions regarding their employment goals and how they communicate their needs to potential employers. This approach respects the client's autonomy and the employer's perspective, fostering a collaborative and transparent process. An incorrect approach that involves the counselor directly negotiating job accommodations or making definitive statements about the client's ability to perform tasks without explicit client authorization and employer input would represent a failure to adhere to ethical standards. This could include violating client confidentiality by sharing information beyond what the client has consented to, exceeding the scope of the counselor's role by acting as an employment agent, and potentially misrepresenting the client's capabilities, which could lead to legal repercussions for both the counselor and the client. Furthermore, it undermines the client's ability to develop self-advocacy skills. Another incorrect approach, such as withholding relevant information about the client's functional limitations from the employer out of a desire to protect the client, would be ethically problematic. This failure to provide accurate and complete information, when authorized by the client, can lead to misunderstandings and ultimately hinder the client's successful reintegration into the workforce. It also fails to acknowledge the employer's need for sufficient information to make informed decisions about reasonable accommodations. The professional decision-making process for similar situations should involve a thorough assessment of the client's goals, capabilities, and expressed desires. The counselor must then engage in open communication with the client about potential employment opportunities, the employer's perspective, and the client's rights and responsibilities. This includes discussing how the client wishes to disclose their disability and any necessary accommodations. Collaboration with the client to develop a communication strategy that respects their autonomy and promotes transparency with the employer is paramount. The counselor's role is to support the client in this process, providing information and guidance, but ultimately deferring to the client's decisions regarding their employment. Question 7. What factors determine the selection of appropriate assessment tools for a certified rehabilitation counselor working with a diverse client population, ensuring both ethical practice and effective rehabilitation planning? Option A. the speed at which the assessment can be completed, and the number of clients that can be assessed within a given time frame. Option B, the ease of administration and scoring of the assessment tool, and its familiarity to the rehabilitation counselor. Option C, the cost of the assessment tool and its availability within the rehabilitation agency's budget. Option D, the validity and reliability of the assessment tool for the specific client population and presenting problem, alongside cultural appropriateness and relevance to the client's rehabilitation goals. The correct answer is D, the validity and reliability of the assessment tool for the specific client population and presenting problem, alongside cultural appropriateness and relevance to the client's rehabilitation goals. Explanation: scenario analysis. This scenario is professionally challenging because rehabilitation counselors must navigate a complex landscape of client needs, available resources, and the ethical imperative to select assessment tools that are both valid and reliable for the specific individual and their unique circumstances. The pressure to quickly identify appropriate interventions can lead to a temptation to use familiar or readily available assessments, potentially overlooking more suitable options. This requires careful judgment to balance efficiency with the fundamental duty of care. Correct approach analysis. The correct approach emphasizes a systematic, client-centered process that prioritizes the selection of assessments based on their appropriateness for the individuals presenting issues, cultural background, and specific rehabilitation goals. This aligns with the ethical standards of the Certified Rehabilitation Counselor (CRC) profession, which mandate that counselors use assessment instruments that are valid and reliable for the intended purpose and population. It also reflects best professional practice by ensuring that the assessment process is tailored to the client's needs, leading to more accurate diagnosis, effective treatment planning, and ultimately, better rehabilitation outcomes. This approach upholds the principle of client welfare and promotes evidence-based practice. Incorrect approaches analysis. One incorrect approach involves relying solely on assessments that are most familiar to the counselor or those that are quickest to administer. This fails to meet the ethical requirement of using valid and reliable instruments for the specific client and their situation. It can lead to misdiagnosis, inappropriate interventions, and a failure to address the client's actual needs, thereby violating the counselor's duty of care and potentially leading to harm. This approach prioritizes counselor convenience over client well-being. Another incorrect approach is to select assessments based primarily on their cost-effectiveness or availability within an agency, without a thorough evaluation of their psychometric properties or suitability for the client. While resource constraints are a reality, ethical practice dictates that client needs and the integrity of the assessment process must take precedence. Using inappropriate assessments due to cost or availability can result in inaccurate data, leading to ineffective or even detrimental rehabilitation plans, and constitutes a failure to uphold professional standards. A third incorrect approach is to use a one-size-fits-all battery of assessments for all clients, regardless of their presenting problems or background. This ignores the diversity of client needs and the principle that assessment should be individualized. Such a rigid approach can lead to the collection of irrelevant data, miss critical information, and fail to capture the nuances of a client's situation, thereby undermining the effectiveness of the rehabilitation process and violating ethical guidelines that call for individualized assessment. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough understanding of the client's presenting issues, referral information, and initial observations. This should be followed by a review of potential assessment tools, considering their psychometric properties, validity, reliability, cultural appropriateness, and relevance to the client's specific goals and context. The counselor should then select the most appropriate assessment, that will yield the most accurate and useful information for developing an individualized rehabilitation plan. This process requires ongoing critical evaluation and a commitment to client-centered, evidence-based practice, always prioritizing the client's welfare and adhering to professional ethical codes. Question 8. When evaluating a client's vocational strengths and limitations for rehabilitation planning, and the client expresses significant anxiety and reluctance towards completing a standardized vocational interest inventory, what is the most ethically sound and professionally effective approach for the certified rehabilitation counselor to take? Option A. Suggest that the client postpone the assessment until they feel more comfortable, without offering alternative assessment strategies to avoid further distress. Option B. Proceed with administering the standardized vocational interest inventory, as it is a widely accepted and reliable tool, explaining to the client that it is a necessary component of the assessment process for accurate planning. Option C. Discuss the client's anxieties, explore the reasons behind their reluctance, and collaboratively determine if alternative assessment methods, such as structured interviews, work sample analysis, or situational assessments, can provide the necessary information to supplement or replace the inventory. Option D. Acknowledge the client's anxiety, but inform them that the standardized inventory is the most objective measure available, and that their participation is mandatory for service eligibility. The correct answer is C. Discuss the client's anxieties, explore the reasons behind their reluctance, and collaboratively determine if alternative assessment methods, such as structured interviews, work sample analysis, or situational assessments, can provide the necessary information to supplement or replace the inventory. Explanation. This scenario presents a professional challenge because the Certified Rehabilitation Counselor, CRC, must balance the need for comprehensive assessment with the client's expressed preferences and potential limitations. The client's reluctance to engage with certain assessment tools, coupled with the counselor's ethical obligation to gather sufficient information for effective service planning, requires careful judgment. The counselor must consider the validity and reliability of alternative assessment methods while respecting client autonomy and avoiding undue pressure. The correct approach represents best professional practice because it prioritizes a multifaceted evaluation that integrates formal assessment with client-centered information gathering. This aligns with the ethical standards of the Certified Rehabilitation Counselor Code of Ethics, which emphasizes the importance of using appropriate assessment tools and techniques, and the need to involve clients in the assessment process. By using a combination of standardized instruments and informal methods like interviews and observation, the counselor can obtain a more holistic understanding of the client's strengths, needs, and barriers to rehabilitation. This approach respects the client's right to self-determination and ensures that the assessment is relevant and meaningful to their rehabilitation goals, thereby promoting informed consent and collaborative goal setting. An incorrect approach that relies solely on standardized testing, without considering the client's comfort or engagement, would fail to meet ethical standards by potentially yielding incomplete or inaccurate data if the client is not fully participating. This could also violate the principle of client welfare by imposing assessments that are not conducive to a positive therapeutic alliance. Another incorrect approach that dismisses the client's concerns and proceeds with assessments they are uncomfortable with would violate the ethical principle of respect for persons and their autonomy, potentially damaging the therapeutic relationship and hindering progress. Furthermore, failing to explore alternative, client-appropriate assessment methods when formal ones are problematic would be a failure to exercise due diligence in gathering necessary information, potentially leading to misdiagnosis or ineffective service planning, which contravenes the counselor's responsibility to provide competent services. Professionals should approach such situations by first actively listening to and validating the client's concerns regarding assessment. They should then collaboratively explore the purpose and nature of the assessments, explaining how they contribute to rehabilitation planning. If a client expresses significant discomfort or resistance to a particular tool, the counselor should explore the reasons behind this and discuss potential alternatives. This might involve using different assessment instruments, employing more informal methods, or breaking down the assessment process into smaller, more manageable steps. The decision-making process should be guided by the ethical principles of beneficence, non-maleficence, justice, and respect for autonomy, always prioritizing the client's well-being and their active participation in their rehabilitation journey. Question 9. Market research demonstrates that clients often present with a desire for vocational guidance, but may have limited self-awareness regarding their career interests and aptitudes. A certified rehabilitation counselor is working with a client who has completed a Holland Code assessment. The counselor needs to determine the most effective and ethical way to utilize these results to support the client's career exploration and decision-making process. Which of the following approaches best aligns with professional best practices and ethical guidelines for rehabilitation counseling? Option A. Present the client's dominant Holland Code and a precompiled list of occupations that are typically associated with that code, encouraging the client to select from this limited list. Option B. Discuss the client's Holland code results collaboratively, exploring the congruence between the descriptions of the different types and the client's self-perceptions and experiences, and then use this as a springboard for broader career exploration, considering a wide range of occupations and other relevant factors. Option C. Focus on the client's highest-scoring Holland code and immediately begin to identify specific job training programs that align with that code, without further exploration of the client's broader interests or the nuances of the different Holland types. Option D. Use the Holland code as a definitive label for the client, informing them that this code dictates their best-fit career path and that exploring outside of this defined area would likely be unsuccessful. The correct answer is A. Present the client's dominant Holland code and a precompiled list of occupations that are typically associated with that code, encouraging the client to select from this limited list. Explanation. This scenario presents a professional challenge because it requires a rehabilitation counselor to move beyond a superficial understanding of Holland's theory of career choice and apply it in a way that respects client autonomy and promotes genuine vocational exploration. The counselor must balance the theoretical framework with the individual client's unique experiences, preferences, and the practical realities of the labor market. Careful judgment is required to avoid imposing a typology on the client or limiting their perceived options. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered application of Holland's theory, using the theory as a framework for discussion and exploration, rather than a definitive categorization. The counselor facilitates the client's self-discovery. This aligns with ethical guidelines that emphasize informed consent, client self-determination, and the use of assessment tools in a manner that enhances understanding and decision-making, not dictates it. The counselor's role is to empower the client to interpret their results and explore congruent career paths, ensuring the client remains the primary agent in their vocational journey. An incorrect approach that relies solely on matching the client's assessment results to a predefined list of occupations within their dominant Holland code, fails to acknowledge the complexity of individual career development. This approach risks oversimplification and can lead to a narrow, potentially dissatisfying vocational outcome for the client. Ethically, this could be seen as a failure to provide comprehensive vocational counseling, potentially violating principles of client welfare and competence by not exploring the full spectrum of possibilities or considering other influencing factors. Another incorrect approach, which involves presenting the Holland code as a definitive label that dictates the client's best-fit career, is problematic. This method undermines client autonomy and can create a self-fulfilling prophecy, limiting the client's willingness to consider alternative paths. It also ignores the dynamic nature of career development and the potential for individuals to thrive in roles that may not perfectly align with their primary code. This approach could be considered a misapplication of the theory, potentially leading to client dissatisfaction and a failure to meet their vocational needs, which is contrary to professional ethical standards. A third incorrect approach, where the counselor uses the Holland code primarily to justify pre-existing assumptions about the client's capabilities or interests without genuine exploration, is also professionally unsound. This can lead to biased counseling and may prevent the client from discovering their true potential or exploring careers they might otherwise find fulfilling. It represents a failure to conduct a thorough and objective vocational assessment, potentially violating ethical obligations to provide unbiased guidance and support. Professionals should approach situations like this by first understanding the client's goals and concerns. They should then introduce Holland's theory as a tool for self-exploration, explaining its purpose and limitations. The assessment results should be discussed collaboratively, encouraging the client to reflect on their congruence with the descriptions. The counselor should then facilitate exploration of a wide range of occupations, using the Holland framework to identify potential matches and areas for further investigation, while also considering other factors such as skills, values, and labor market realities. This iterative process ensures the client is an active participant in their vocational planning. Question 10. The control framework reveals that a certified rehabilitation counselor is working with a client experiencing significant vocational challenges due to a recent diagnosis of a chronic physical illness and co-occurring anxiety. The client expresses a desire to return to work, but is also experiencing low self-efficacy and fear of relapse. The counselor is considering how to best integrate different therapeutic approaches to address these complex needs. Which of the following represents the most ethically sound and professionally effective integrative approach? Option A. Applying an eclectic mix of techniques from various counseling theories without a clear rationale or systematic integration, hoping that some interventions will prove beneficial. Option B. Primarily utilizing a psychodynamic approach to explore the underlying roots of the client's low self-efficacy, with minimal consideration for the immediate vocational and anxiety management needs. Option C. Systematically integrating evidence-based interventions from cognitive behavioral therapy, CBT, for anxiety and motivational interviewing, MI, for vocational goal setting, while continuously assessing the client's response and adjusting the integration based on their progress and feedback. Option D. Focusing exclusively on vocational assessment and job placement services, assuming that addressing the practical aspects will resolve the client's anxiety and self-efficacy issues. The correct answer is C. Systematically integrating evidence-based interventions from cognitive behavioral therapy, CBT, for anxiety and motivational interviewing, MI, for vocational goal setting, while continuously assessing the client's response and adjusting the integration based on their progress and feedback. Explanation. This scenario presents a professional challenge due to the need to integrate diverse therapeutic modalities while ensuring the client's well-being and adherence to ethical guidelines for certified rehabilitation counselors, CRC. The CRC must navigate the complexities of a client with multiple co-occurring conditions, requiring a nuanced understanding of how different theoretical orientations can complement each other, without causing fragmentation or conflicting interventions. The challenge lies in selecting and applying an integrative approach that is evidence-based, client-centered, and respects the client's autonomy and cultural background, all within the scope of practice for a CRC. The correct approach represents best professional practice because it prioritizes a systematic and client-driven integration of therapeutic strategies. This involves a thorough assessment of the client's needs, strengths, and preferences, followed by the judicious selection of interventions from various theoretical orientations that are known to be effective for the specific presenting issues. This approach aligns with the ethical principles of beneficence and non-maleficence, ensuring that interventions are helpful and do not cause harm. Furthermore, it upholds the principle of client autonomy by involving the client in the decision-making process regarding their treatment plan. Adherence to the CRC Code of Ethics, which emphasizes the importance of using evidence-based practices and maintaining professional competence, is paramount. An incorrect approach that relies solely on one theoretical orientation without considering the client's multifaceted needs would be professionally unacceptable. This failure would violate the principle of providing comprehensive and individualized care. Another incorrect approach might involve indiscriminately applying techniques from various modalities without a clear rationale or understanding of their synergistic effects, potentially leading to a fragmented and ineffective treatment plan. This could be considered a failure to maintain professional competence and to act in the client's best interest, as it risks causing confusion or distress to the client. A further incorrect approach could be to adopt an integrative model without adequate training or supervision in the chosen modalities, which would be a direct violation of ethical standards regarding professional competence and scope of practice. The professional decision-making process for similar situations should begin with a comprehensive biopsychosocial spiritual assessment. This assessment should inform the selection of an integrative framework that best suits the client's unique circumstances. The CRC should then collaboratively develop a treatment plan with the client, clearly outlining the rationale for integrating specific approaches and the expected benefits. Ongoing evaluation of the treatment's effectiveness and the client's progress is crucial, with flexibility to adjust the integrative strategy as needed. Consultation with supervisors or peers, particularly when dealing with complex cases or unfamiliar modalities, is an essential component of ethical practice. Question 11. The risk matrix shows a high probability of vocational dissatisfaction and potential for client distress if the rehabilitation counselor immediately pursues a client's stated vocational goal without further assessment, given the client's limited transferable skills and significant sensory processing challenges. The counselor has identified a more suitable vocational path that aligns better with the client's strengths and has a higher likelihood of successful long-term employment, What is the most ethically and professionally responsible course of action for the rehabilitation counselor? Option A. Proceed with the client's stated vocational goal as requested, focusing on job placement in that area and addressing any subsequent challenges as they arise to avoid discouraging the client. Option B. Politely inform the client that their stated vocational goal is not feasible due to their limitations, and unilaterally present the alternative vocational path as the only viable option. Option C. Engage in a collaborative discussion with the client, presenting the assessment findings and exploring the identified more suitable vocational path, while also acknowledging and validating the client's initial preference and working together to develop a revised, realistic plan. Option D. Immediately advocate for the client's stated vocational goal, believing that client self-determination is paramount, and that the counselor's role is to support the client's wishes regardless of perceived feasibility. The correct answer is C. Engage in a collaborative discussion with the client, presenting the assessment findings and exploring the identified more suitable vocational path, while also acknowledging and validating the client's initial preference and working together to develop a revised, realistic plan. Explanation. This scenario presents a professional challenge because the rehabilitation counselor must balance the client's expressed desires with their own professional judgment regarding the client's capacity and the potential for harm or ineffectiveness. The counselor's role is to advocate for the client, while also ensuring that interventions are appropriate, ethical, and aligned with professional standards. The counselor must consider the client's self-determination, but also their duty to provide competent and ethical services, which includes assessing the client's readiness and ability to benefit from a particular vocational path. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the client's skills, interests, and limitations, and then collaboratively develops a plan that is realistic and achievable. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that the client is not placed in a situation where they are likely to experience failure or distress due to an ill-fitting vocational goal. It also upholds the principle of client autonomy by involving the client in the decision-making process after providing them with accurate information and professional guidance. This approach is consistent with the ethical codes of the certified rehabilitation counselor, which emphasize client well-being, informed consent, and professional competence. An incorrect approach that focuses solely on the client's stated preference without adequate assessment fails to uphold the counselor's responsibility to ensure the client's best interests and to provide competent services. This could lead to a situation where the client is set up for failure, potentially causing psychological distress and undermining the rehabilitation process. This would be a violation of the ethical principle of non-maleficence. Another incorrect approach that dismisses the client's preference outright without thorough exploration and explanation of concerns would violate the principle of client autonomy and self-determination. While the counselor has a duty to provide professional guidance, unilaterally rejecting a client's goal without collaborative discussion and justification can be disempowering and damage the therapeutic alliance. This could be seen as paternalistic and not in line with client-centered practice. A third incorrect approach that involves pursuing the client's stated goal without any consideration of its feasibility or potential negative outcomes ignores the counselor's professional responsibility to assess and guide. This could lead to wasted resources, client frustration, and a failure to achieve meaningful rehabilitation outcomes, thereby failing to act in the client's best interest. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and acknowledge the client's stated goal. Second, conduct a thorough assessment of the client's current skills, interests, aptitudes, and any limitations that might impact the feasibility of the goal. Third, collaboratively discuss the assessment findings with the client, explaining any concerns or potential challenges in a clear and supportive manner. Fourth, explore alternative vocational paths that align with the client's strengths and interests, and that are more likely to lead to successful and sustainable employment. Fifth, jointly develop a revised, realistic, and achievable rehabilitation plan that respects the client's autonomy while ensuring professional competence and ethical practice. Question 12. Strategic planning requires a certified rehabilitation counselor to consider how a client's unconscious conflicts, stemming from early life experiences and relational patterns, might be manifesting as resistance to vocational exploration and goal setting. When a client expresses significant anxiety and avoidance regarding job searching, attributing it to a fear of failure rooted in a deep-seated belief of inadequacy, what is the most appropriate psychodynamically informed approach to facilitate progress? Option A. Reframe the client's anxiety as a normal reaction to the job market and encourage them to push through it by focusing on the practical benefits of employment, such as financial independence and social integration. Option B. Facilitate a deeper exploration of the client's feelings of inadequacy, examining the origins of these beliefs in their past relationships and experiences, to build insight and reduce the unconscious anxiety that is driving the vocational avoidance. Option C. Encourage the client to confront their fears directly by setting small, achievable vocational goals and providing immediate positive reinforcement for any attempt, regardless of outcome, to override the negative self-perceptions. Option D. Focus on developing concrete job search skills and strategies, such as resume writing and interview preparation, to build the client's confidence through tangible achievements and external validation. The correct answer is B. Facilitate a deeper exploration of the client's feelings of inadequacy, examining the origins of these beliefs in their past relationships and experiences, to build insight and reduce the unconscious anxiety that is driving the vocational avoidance. Explanation. This scenario presents a professional challenge because the Certified Rehabilitation Counselor, CRC, must integrate a client's deeply ingrained psychodynamic patterns into a rehabilitation plan without imposing personal biases or misinterpreting the client's resistance. The client's reluctance to engage with vocational exploration, stemming from unconscious conflicts related to past trauma and perceived inadequacy, requires a nuanced approach that respects the client's internal world while still moving towards rehabilitation goals. Careful judgment is needed to differentiate between genuine therapeutic impasse and resistance that can be addressed through a psychodynamically informed lens. The correct approach represents best professional practice because it acknowledges the profound impact of unconscious processes on a client's vocational functioning, as central to psychodynamic theory. By exploring the underlying emotional and relational dynamics that contribute to the client's vocational barriers, the CRC can facilitate deeper self-understanding and address the root causes of resistance. This aligns with the ethical principles of client autonomy and beneficence, ensuring that interventions are tailored to the client's unique psychological landscape and promote genuine, sustainable progress. The CRC's role is to help the client gain insight into how their past experiences and internal conflicts are manifesting in their present vocational challenges, thereby empowering them to make more conscious and effective choices. An incorrect approach that focuses solely on external barriers, such as job market conditions or skill deficits, fails to address the psychodynamic underpinnings of the client's vocational struggles. This represents a regulatory and ethical failure because it neglects a significant aspect of the client's functioning, potentially leading to superficial or ineffective interventions. It violates the principle of comprehensive assessment and intervention, as it overlooks the internal psychological factors that are demonstrably impacting the client's ability to engage in rehabilitation. Another incorrect approach that dismisses the client's resistance as mere stubbornness or lack of motivation, without exploring its psychodynamic origins, is also professionally unacceptable. This demonstrates a lack of understanding of psychodynamic principles and can lead to a punitive or confrontational stance, damaging the therapeutic alliance and potentially re-traumatizing the client. Ethically, this approach fails to uphold the duty of care and respect for the client's subjective experience. A third incorrect approach that attempts to force the client into vocational exploration prematurely, without adequately addressing the underlying psychodynamic issues, risks exacerbating the client's anxiety and resistance. This can be seen as a failure to adhere to the principle of do no harm and a disregard for the client's readiness for specific interventions. It prioritizes a procedural outcome over the client's psychological well-being and readiness for change. The professional decision-making process for similar situations involves a thorough assessment that integrates psychodynamic understanding with practical rehabilitation goals. Professionals should continuously evaluate the client's resistance not as an obstacle to be overcome, but as a potential source of information about their internal world. This requires a flexible and client-centered approach, where interventions are adapted based on the client's evolving psychological state and the insights gained from exploring their unconscious dynamics. The CRC must maintain a stance of curiosity and empathy, facilitating a process of exploration rather than dictating solutions. Question 13. Process analysis reveals that a certified rehabilitation counselor is working with a client who expresses a strong desire to return to competitive employment, but consistently avoids engaging in vocational exploration activities, citing feelings of anxiety and being overwhelmed. The counselor has previously attempted to introduce various vocational assessment tools and job search strategies, which the client has deflected. The counselor is considering how to best apply rehabilitation theories to address this impasse. Which of the following theoretical applications would most effectively and ethically guide the counselor's next steps? Option A. Focusing solely on external environmental barriers, such as transportation or employer attitudes, to explain the client's reluctance, and developing strategies to mitigate these external factors. Option B. Employing a client-centered approach to explore the client's feelings and perceptions regarding vocational exploration, collaboratively identifying the underlying causes of their anxiety and overwhelm before proceeding with specific vocational interventions. Option C. Immediately implementing a structured, directive vocational assessment battery to objectively identify suitable job placements, assuming the client's resistance stems from a lack of clear direction. Option D. Recommending a period of complete rest from vocational pursuits until the client demonstrates a more proactive attitude, believing that external pressure is counterproductive. The correct answer is B. Employing a client-centered approach to explore the client's feelings and perceptions regarding vocational exploration, collaboratively identifying the underlying causes of their anxiety and overwhelm before proceeding with specific vocational interventions. Explanation. This scenario presents a common challenge in rehabilitation counseling, balancing client autonomy with the counselor's ethical and professional responsibility to facilitate progress. The client's resistance to exploring vocational options, despite expressing a desire for employment, creates a therapeutic impasse. A key aspect of rehabilitation counseling is the application of theoretical frameworks to guide interventions. The challenge lies in selecting and applying a theory that respects the client's pace and self-determination while still promoting movement towards rehabilitation goals. The correct approach involves utilizing a theory that emphasizes the client's active role in the rehabilitation process and acknowledges potential barriers to engagement. A client-centered approach, for instance, would focus on building rapport, exploring the client's feelings and perceptions about vocational exploration, and collaboratively identifying the root of their resistance. This aligns with ethical principles of respect for persons and self-determination, as mandated by professional rehabilitation counseling standards. By empowering the client to lead the exploration of their barriers, the counselor facilitates intrinsic motivation and sustainable change. An incorrect approach would be to impose a specific vocational plan or to dismiss the client's expressed feelings of anxiety or overwhelm. For example, immediately pushing a standardized vocational assessment without addressing the client's emotional state could be seen as a failure to adhere to the principle of client-centered care. This might violate ethical guidelines that require counselors to work collaboratively with clients and to be sensitive to their individual needs and readiness for change. Another incorrect approach would be to solely focus on external barriers without exploring the client's internal psychological responses, potentially overlooking crucial factors contributing to their stagnation. This could also be a deviation from a holistic, person-centered rehabilitation model. Professionals should approach such situations by first conducting a thorough assessment of the client's presenting concerns, including their emotional state, perceived barriers, and readiness for change. This assessment should be guided by theoretical frameworks that inform understanding of motivation, behavior change, and the therapeutic relationship. The counselor should then collaboratively develop an intervention plan with the client, prioritizing their goals and preferences. Regular evaluation of the intervention's effectiveness and flexibility in adjusting the plan based on client feedback are crucial components of ethical and effective rehabilitation counseling. Question 14. System analysis indicates that a certified rehabilitation counselor is conducting a risk assessment for a client with a recent spinal cord injury, aiming to identify suitable vocational pathways. The client expresses a strong interest in a physically demanding trade that was their pre-injury occupation. Considering Super's life space theory, which of the following approaches to the risk assessment would best promote the client's long-term vocational adjustment and life satisfaction? Option A. relying solely on standardized vocational interest inventories to identify alternative career options, without engaging in a detailed discussion about the client's life roles, values, and the practical implications of different career paths within their broader life context. Option B, recommending a completely different, less physically demanding vocational field based on a generalized assessment of physical limitations, without thoroughly exploring the client's specific interests or potential for adaptation in their preferred area. Option C, focusing primarily on the client's expressed desire to return to their previous physically demanding trade, assuming that maintaining continuity will be the most psychologically beneficial outcome. Option D, evaluating the client's current physical capacity for the trade, exploring adaptive technologies and modified work environments within that field, and discussing potential future career transitions or complementary roles that leverage transferable skills and accommodate potential future physical changes. The correct answer is D, evaluating the client's current physical capacity for the trade, exploring adaptive technologies and modified work environments within that field, and discussing potential future career transitions or complementary roles that leverage transferable skills and accommodate potential future physical changes. Explanation: this scenario presents a professional challenge because it requires the Certified Rehabilitation Counselor, CRC, to balance the immediate need for vocational assessment with the long-term implications of career development, as outlined by Super's lifespan, life space theory. The theory emphasizes that career development is a continuous process influenced by an individual's evolving life roles and experiences across their lifespan. A risk assessment in this context must consider not only current employability, but also the client's potential for growth, adaptation, and satisfaction over time, which can be significantly impacted by the chosen vocational path. Careful judgment is required to avoid pigeonholing the client into a role that may not align with their future aspirations or life circumstances. The correct approach represents best professional practice because it integrates Super's lifespan, life space theory by conducting a comprehensive risk assessment that considers the client's current life roles, developmental stage, and potential future life space changes. This approach acknowledges that vocational choices are not static and that a client's ability to adapt to future life events, e.g., family changes, health fluctuation, personal growth, is a crucial factor in long-term career satisfaction and stability. This aligns with ethical guidelines for CRCs that mandate a holistic and client-centered approach, promoting self-determination and maximizing the client's potential for successful rehabilitation and life adjustment. An incorrect approach that focuses solely on immediate job placement without considering the client's broader life context and developmental trajectory fails to adhere to the principles of Super's theory. This could lead to a vocational plan that is unsustainable or dissatisfying in the long run, potentially requiring further intervention and undermining the client's progress. Ethically, this approach risks violating the principle of beneficence by not acting in the client's best long-term interest. Another incorrect approach that prioritizes a single, highly specialized vocational track without exploring alternative or adaptable options overlooks the dynamic nature of life and career. This can create a significant risk if the chosen field experiences economic downturns or if the client's interests or abilities shift. Such an approach may also fail to consider the client's life space, the various roles and environments that influence their career choices and satisfaction. This could be seen as a failure to provide adequate counseling and support, potentially violating standards of care. A further incorrect approach that relies heavily on standardized vocational aptitude tests without qualitative exploration of the client's values, interests, and life experiences neglects the subjective and developmental aspects of career development central to Super's theory. While tests can provide data, they do not capture the full picture of an individual's potential or their capacity to navigate the complexities of life and work. This can lead to a risk assessment that is incomplete and may not accurately predict long-term vocational success or satisfaction. The professional decision-making process for similar situations should involve a thorough understanding of the client's current situation, their developmental stage, and their aspirations within the framework of Super's lifespan, life space theory. This includes exploring their current and potential future life roles, identifying potential barriers and facilitators to vocational success, and assessing their adaptability to life changes. The risk assessment should be a dynamic process, revisited as the client progresses and their circumstances evolve, ensuring that the rehabilitation plan remains relevant and supportive of their overall well-being and long-term goals. Question 15. The assessment process reveals a client who expresses a strong desire for a career change, but also significant anxiety about acquiring new skills and the uncertainty of the job market. The client has a history of stable employment in a declining industry, which theoretical framework would best guide the counselor in addressing both the client's aspirations and their underlying concerns. Option A. Krumboltz's social learning theory of career decision-making. Option B. Tiedemann and O'Hara's theory of career development. Option C. Super's life-space theory. Option D. Holland's theory of vocational personalities. The correct answer is C. Super's life-space theory. Explanation. This scenario presents a professional challenge because the rehabilitation counselor must integrate theoretical understanding of career development with the client's unique lived experience and vocational aspirations, while adhering to ethical guidelines and best practices. The client's expressed desire for a career change, coupled with their stated anxieties about skill acquisition, necessitates a nuanced approach that goes beyond simply identifying job openings. Careful judgment is required to select a career development theory that best explains the client's current situation and guides the intervention strategy effectively. The correct approach represents best professional practice because it aligns with the core principles of client-centered counseling and evidence-based practice in rehabilitation. By selecting a theory that acknowledges the interplay of personal factors, environmental influences, and developmental stages, the counselor can develop a tailored intervention plan. This plan will likely involve exploring the client's interests, values, and aptitudes, while also addressing their anxieties and providing support for skill development. This approach is ethically sound as it prioritizes the client's autonomy, well-being, and informed participation in the career development process, as mandated by professional codes of ethics for certified rehabilitation counselors. An incorrect approach that focuses solely on immediate job placement without considering the underlying developmental factors would be professionally unacceptable. This would fail to address the client's anxieties and potential for future dissatisfaction, potentially leading to a cycle of job changes and unmet vocational goals. Such an approach could violate ethical principles related to competence and client welfare by not providing comprehensive services. Another incorrect approach that relies on a single, rigid theoretical framework without considering the client's individual context would also be professionally unsound. Rehabilitation counseling requires flexibility and the ability to adapt theoretical models to fit the client's specific needs and circumstances. Ignoring the client's personal narrative and focusing only on abstract theoretical constructs would be a failure of ethical practice, as it would not be client-centered. A further incorrect approach that prioritizes external labor market demands over the client's internal motivations and capabilities would also be ethically problematic. While labor market information is important, the ultimate goal of career development is to facilitate a fulfilling and sustainable vocational path for the individual. Neglecting the client's personal fit for a role, even if it is in high demand, would not serve their long-term vocational adjustment. The professional decision-making process for similar situations should involve a thorough assessment of the client's strengths, challenges, interests, values, and environmental factors. The counselor should then critically evaluate various career development theories to determine which best conceptualizes the client's situation and informs the most effective intervention strategies. This involves a dynamic interplay between theory, empirical evidence, and the client's lived experience, always prioritizing the client's goals and well-being within the ethical and regulatory framework of certified rehabilitation counseling. Question 16. The performance metrics show a consistent pattern where individuals with similar demographic profiles are achieving significantly different scores on a standardized vocational aptitude test administered as part of their rehabilitation plan. Which of the following actions best addresses this observation in accordance with professional rehabilitation counseling standards? Option A. Immediately discontinue the use of the standardized vocational aptitude test and seek an alternative assessment instrument for all future clients. Option B. Conclude that the observed score differences are solely attributable to inherent differences in the client's vocational aptitudes and adjust rehabilitation goals accordingly. Option C. Initiate a review of the standardized test's psychometric properties and investigate potential environmental or situational factors influencing test performance for this specific client group. Option D. Focus solely on the raw scores obtained from the test to determine the most appropriate rehabilitation interventions, without further inquiry into the discrepancies. Correct answer is C. Initiate a review of the standardized test's psychometric properties and investigate potential environmental or situational factors influencing test performance for this specific client group. Explanation: the performance metrics show a consistent pattern where individuals with similar demographic profiles are achieving significantly different scores on a standardized vocational aptitude test administered as part of their rehabilitation plan. This scenario is professionally challenging because it raises concerns about the validity and fairness of the assessment tool itself and its potential to inaccurately guide rehabilitation interventions. Careful judgment is required to determine if the test is truly measuring aptitude or if it is inadvertently reflecting biases or external factors not related to the individual's rehabilitation potential. The correct approach involves a thorough review of the standardized test's psychometric properties, including its reliability and validity for the specific population being served. This includes examining whether the test has been normed on a representative sample that includes individuals with similar backgrounds and disabilities. Furthermore, best professional practice dictates investigating potential environmental or situational factors that might be influencing test performance, such as the testing environment, the administrator's rapport, or the client's current state of well-being. This aligns with the ethical principles of ensuring assessments are fair, unbiased, and used appropriately to inform individualized rehabilitation plans, as mandated by professional standards and potentially by regulations governing the use of assessment tools in federally funded rehabilitation programs. An incorrect approach would be to solely rely on the raw scores without further investigation. This fails to acknowledge the potential for test bias and the importance of contextual factors in assessment, which is a violation of ethical guidelines that require counselors to use assessment instruments appropriately and to interpret results with caution, considering individual circumstances. Another incorrect approach would be to immediately dismiss the test and seek an alternative without first attempting to understand the discrepancies observed. This bypasses the due diligence required to validate or invalidate the current assessment tool and could lead to the premature abandonment of a potentially useful instrument. A third incorrect approach would be to attribute the score differences solely to individual client deficits without considering the test's limitations or external influences. This demonstrates a lack of critical evaluation of the assessment process and can lead to misdiagnosis and ineffective interventions, contravening the principle of client-centered practice. Professionals should employ a decision-making framework that prioritizes a systematic evaluation of assessment data. This involves 1. Reviewing the psychometric properties of the chosen standardized test. 2. Considering the individual client's background, circumstances, and any accommodations needed during testing. 3. Analyzing the test results in conjunction with other sources of information, e.g., interviews, observations, previous records, and 4. Making informed decisions about the test's utility and the appropriate course of action for the rehabilitation plan. If significant discrepancies arise, further investigation into potential bias or administration issues is paramount before altering or discarding the assessment tool. Question 17. The evaluation methodology shows a client expressing a strong desire to return to their previous highly demanding physical occupation, despite significant functional limitations documented in their medical records and a recent vocational assessment indicating a substantial decrease in their capacity for such work. The rehabilitation counselor is considering how to proceed with goal setting. Which of the following approaches best aligns with the certified rehabilitation counselor's ethical and regulatory responsibilities? Option A. Immediately redirect the client towards a less physically demanding occupation that the counselor believes is more achievable based on the initial assessment, without extensively exploring the client's original vocational aspiration. Option B. Engage in a collaborative discussion with the client to explore the feasibility of their desired occupation. Present the assessment findings regarding their current functional capacities and potential barriers, and jointly develop alternative vocational goals that leverage their strengths and transferable skills, while also exploring potential accommodations or assistive technologies that might support a return to their previous role if deemed viable. Option C. Accept the client's stated vocational goal without further assessment or discussion, assuming that the client's motivation will overcome their current limitations. Option D. Focus solely on the client's medical limitations and recommend a program of rest and passive therapies, deferring any vocational goal setting until the client's physical condition has stabilized, regardless of their expressed desire for vocational rehabilitation. The correct answer is B. Engage in a collaborative discussion with the client to explore the feasibility of their desired occupation. Present the assessment findings regarding their current functional capacities and potential barriers, and jointly develop alternative vocational goals that leverage their strengths and transferable skills, while also exploring potential accommodations or assistive technologies that might support a return to their previous role if deemed viable. Explanation. This scenario presents a common challenge in rehabilitation counseling, balancing the client's expressed desires with the counselor's professional judgment regarding the feasibility and appropriateness of rehabilitation goals, all within the established regulatory framework for Certified Rehabilitation Counselors, CRC. The core of the challenge lies in the potential for a mismatch between a client's aspirations and their current functional capacities, as well as the availability of resources and services. A CRC must navigate this delicate balance while adhering to ethical principles and regulatory mandates that prioritize client autonomy, informed consent, and the promotion of functional independence and vocational outcomes. The correct approach represents best professional practice because it involves a comprehensive, individualized assessment that considers multiple facets of the client's situation. This includes a thorough evaluation of their vocational history, transferable skills, functional limitations, both physical and cognitive, environmental factors, and personal support systems. Crucially, it emphasizes collaborative goal setting, where the counselor educates the client about realistic options, potential barriers, and the services available to address them. This approach aligns with the CRC Code of Professional Ethics, which mandates that counselors work collaboratively with clients to develop goals that are both meaningful to the client and achievable within their circumstances. It also reflects the regulatory emphasis on evidence-based practice and the use of appropriate assessment tools to inform intervention planning. An incorrect approach that focuses solely on the client's initial, potentially unrealistic, stated desire without a thorough assessment fails to uphold the CRC's ethical obligation to provide competent and ethical services. This approach could lead to wasted resources, client frustration, and a failure to achieve meaningful rehabilitation outcomes, potentially violating the principle of beneficence acting in the client's best interest. Another incorrect approach that dismisses the client's desires outright and imposes a counselor-determined goal, even if perceived as more practical, disregards the fundamental ethical principle of client self-determination and autonomy. While counselors have a responsibility to guide clients, imposing goals without genuine client buy-in undermines the therapeutic alliance and can lead to resistance and noncompliance. This violates the client's right to make informed choices about their own rehabilitation journey. A third incorrect approach that prioritizes expediency or the easiest path to closure over a thorough and individualized assessment is ethically unsound. This might involve recommending a readily available, but not necessarily optimal, service without fully exploring the client's unique needs and potential for greater functional or vocational gains. This can be seen as a failure to provide diligent and competent services, potentially leading to suboptimal outcomes and a breach of professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Initiate a comprehensive assessment that includes standardized and non-standardized tools, interviews, and observation to understand the client's strengths, limitations, interests, and environmental context. 2. Engage in open and honest communication with the client, presenting assessment findings clearly and discussing potential rehabilitation pathways, including their pros and cons. 3. Collaboratively establish realistic and achievable goals that are aligned with the client's values and aspirations, while also considering their functional capacities and available resources. 4. Develop an individualized rehabilitation plan that outlines specific interventions, services, and timelines, with regular opportunities for review and adjustment based on client progress and evolving needs. 5. Continuously monitor client progress, provide ongoing support and advocacy, and adapt the plan as necessary to ensure the client's successful reintegration and achievement of their rehabilitation potential. Question 18. Stakeholder feedback indicates that a client's performance on a recently administered standardized psychological assessment does not fully align with their observed strengths and challenges in vocational settings. As a certified rehabilitation counselor, how should you proceed to ensure the most accurate and ethical assessment of this client's rehabilitation needs? Option A. Disregard the standardized assessment results entirely and rely solely on anecdotal observations and stakeholder opinion to guide rehabilitation planning. Option B. Select a different, more popular psychological assessment tool that appears simpler to administer without verifying its psychometric properties or relevance to the client's specific issues. Option C. Integrate the assessment results with other gathered information, such as client interviews, direct observations, and collateral reports to form a comprehensive understanding of the client's functioning. Option D. Rely exclusively on the standardized psychological assessment results, assuming the instrument is universally applicable and objective, and address any discrepancies by reinterpreting the client's behavior to fit the assessment outcomes. The correct answer is C. Integrate the assessment results with other gathered information, such as client interviews, direct observations, and collateral reports, to form a comprehensive understanding of the client's functioning. Explanation. This scenario presents a professional challenge because certified rehabilitation counselors, CRC, are ethically and legally obligated to use assessment tools that are valid, reliable, and appropriate for the client's cultural background and presenting concerns. The challenge lies in balancing the need for comprehensive psychological assessment with the potential for misinterpretation or bias inherent in certain instruments, especially when stakeholder feedback suggests a discrepancy between assessment results and observed client functioning. Careful judgment is required to ensure that assessment practices uphold client dignity, promote accurate diagnosis, and inform effective rehabilitation planning, all within the bounds of the CRC Code of Ethics and relevant professional standards. The correct approach represents best professional practice because it prioritizes a multifaceted evaluation that integrates standardized psychological assessments with other relevant data sources. This aligns with the CRC Code of Ethics, which mandates that CRCs use assessment procedures and instruments that are appropriate to the client's needs and circumstances, and that they interpret assessment results in a manner that considers the client's cultural, linguistic, and social background. Furthermore, it emphasizes the importance of corroborating assessment findings with other information, such as interviews, observations, and collateral information, to ensure a holistic and accurate understanding of the client's strengths, limitations, and needs. This comprehensive approach minimizes the risk of misdiagnosis or inappropriate service recommendations stemming from a single, potentially flawed assessment. An incorrect approach that relies solely on a single, potentially culturally biased psychological assessment instrument fails to meet ethical standards. The CRC Code of Ethics requires CRCs to be aware of and account for the limitations of assessment tools, including potential cultural bias. Using an instrument without considering its psychometric properties for the specific client population, or without corroborating its findings with other data sources, constitutes a failure to provide competent and ethical services. This can lead to inaccurate conclusions about a client's abilities and needs, potentially hindering their rehabilitation progress and violating their right to appropriate and effective services. Another incorrect approach that involves disregarding assessment results entirely due to stakeholder concerns, without a systematic review or further investigation, is also professionally unacceptable. While stakeholder feedback is valuable, it should not lead to the arbitrary dismissal of objective data. Ethical practice requires CRCs to critically evaluate all information, including feedback, and to investigate discrepancies. Ignoring valid assessment data without proper justification can lead to a lack of evidence-based decision-making and potentially overlook critical aspects of a client's condition. A third incorrect approach that involves selecting a new assessment tool based solely on its perceived ease of administration or popularity, without regard for its psychometric properties, validity, or appropriateness for the client's specific issues, is also ethically problematic. CRCs must select assessment tools that are scientifically sound and relevant to the assessment goals. This approach risks using an instrument that is not validated for the client's population or presenting concerns, leading to unreliable or invalid results and undermining the quality of rehabilitation services. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and critically evaluate stakeholder feedback, recognizing its potential value but also its limitations. 2. Review the existing assessment data, considering the psychometric properties of the instruments used, their appropriateness for the client's demographics and presenting issues, and any potential for bias. 3. Gather additional information through further interviews, observations, or collateral contacts to corroborate or challenge existing findings. 4. If discrepancies persist, consider the use of alternative or supplementary assessment tools that are known to be valid and reliable for the client's specific context. 5. Document the entire decision-making process, including the rationale for assessment choices and interpretations, to ensure accountability and transparency. Question 19. Benchmark analysis indicates that a certified rehabilitation counselor is working with a client who has expressed a strong desire to pursue a career in graphic design. Initial assessments suggest the client has good visual spatial reasoning skills, but also significant challenges with sustained attention and fine motor control, which may impact their ability to meet the demands of a typical graphic design role without specific accommodations or alternative approaches. The counselor has gathered data from standardized assessments, client interviews, and a review of medical records. What is the most appropriate next step for the counselor in the assessment and evaluation process? Option A. Engage the client in a collaborative discussion to explore the assessment findings. Discuss potential discrepancies between their vocational aspirations and identified functional limitations, and jointly problem-solve strategies to address these challenges or adjust goals. Option B. Inform the client of the assessment results and unilaterally recommend alternative vocational goals that appear more aligned with their identified strengths, without further discussion of their original aspirations. Option C. Proceed with developing a rehabilitation plan focused solely on graphic design, assuming that the client's motivation will overcome any identified functional barriers. Option D. Immediately advise the client that graphic design is likely not a feasible vocational goal given their current functional limitations, and suggest exploring entirely different career paths. The correct answer is A. Engage the client in a collaborative discussion to explore the assessment findings, discuss potential discrepancies between their vocational aspirations and identified functional limitations, and jointly problem-solve strategies to address these challenges or adjust goals. Explanation. Scenario analysis. This scenario presents a common challenge in rehabilitation counseling, where a client's expressed preferences for vocational goals may not align with objective assessment finding regarding their current functional capacities and potential barriers. The counselor must navigate the ethical imperative to respect client self-determination, while also ensuring that interventions are evidence-based, realistic, and promote successful rehabilitation outcomes. The challenge lies in balancing advocacy for the client's aspirations with the professional responsibility to provide accurate, objective guidance, and to avoid setting the client up for failure or disappointment. Correct approach analysis. The correct approach prioritizes a collaborative and iterative assessment process. It involves a thorough review of all gathered data, including standardized assessments, client interviews, and any medical or psychological reports. The counselor then uses this comprehensive understanding to engage the client in a discussion about the assessment results. This discussion should focus on exploring the implications of the findings for their vocational goals, identifying potential discrepancies, and collaboratively problem-solving to adjust goals or develop strategies to address identified barriers. This approach aligns with the ethical principles of client autonomy and informed consent, as it empowers the client to participate actively in goal setting and decision-making, based on a shared understanding of their strengths and limitations. It also upholds the counselor's responsibility to provide competent and ethical services by ensuring that interventions are grounded in assessment data and are tailored to the individual's needs and capacities, as mandated by professional ethical codes and relevant rehabilitation regulations. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the client's vocational goals because they appear ambitious based on initial assessment data. This violates the principle of client self-determination and can undermine the therapeutic alliance. It fails to acknowledge the client's lived experience and aspirations, potentially leading to disengagement and a perception of being misunderstood or undervalued. Ethically, this approach neglects the counselor's duty to explore and validate client preferences before imposing professional judgment. Another incorrect approach is to proceed with interventions solely based on the client's stated vocational goals without adequately integrating the objective assessment findings. This risks providing services that are misaligned with the client's actual capacities, leading to frustration, lack of progress, and potentially negative outcomes. It represents a failure to conduct a comprehensive assessment and to use that information to guide service planning, which is a core requirement of rehabilitation counseling practice and regulatory frameworks. A third incorrect approach is to unilaterally decide on alternative vocational goals for the client based on the assessment data, without involving the client in the discussion or decision-making process. This is paternalistic and disregards the client's right to self-direction. It also bypasses the crucial step of collaborative goal setting, which is essential for client buy-in and successful rehabilitation. This approach violates ethical principles of respect for persons and autonomy. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the client's presenting issues, preferences, and strengths. This is followed by the administration and interpretation of appropriate assessment tools, considering both subjective and objective data. The next critical step is to engage the client in a dialogue about the assessment findings, fostering a shared understanding of their implications. This collaborative discussion should then lead to the joint development or refinement of realistic and achievable rehabilitation goals, with a clear plan for interventions designed to address identified barriers and leverage strengths. Throughout this process, adherence to ethical codes and relevant regulations governing rehabilitation counseling practice is paramount, ensuring that client rights, dignity, and well-being are protected. Question 20. Operational review demonstrates that current employer engagement strategies for clients transitioning back to work are yielding inconsistent results. Which of the following approaches would best inform the development of a more effective and sustainable employer collaboration framework? Option A. Conduct a comprehensive impact assessment of existing employer engagement practices, analyzing their effectiveness in facilitating client reintegration, identifying barriers to collaboration, and benchmarking against best practices in vocational rehabilitation. Option B. Immediately implement a standardized training program for all employers on disability awareness and accommodation, assuming this will universally improve engagement. Option C. Rely on informal feedback from clients regarding their employers' attitudes and behaviors to guide future engagement strategies. Option D. Focus solely on advocating for increased client benefits and accommodations, without direct engagement or assessment of the employer's operational capacity or willingness to collaborate. The correct answer is A. Conduct a comprehensive impact assessment of existing employer engagement practices, analyzing their effectiveness in facilitating client reintegration, identifying barriers to collaboration, and benchmarking against best practices in vocational rehabilitation. Explanation. This scenario presents a common challenge in rehabilitation counseling, ensuring effective collaboration with employers to facilitate successful return-to-work outcomes for clients. The professional challenge lies in balancing the client's needs and rights with the employer's operational requirements and legal obligations, all while adhering to the ethical standards and regulatory frameworks governing certified rehabilitation counselors. Careful judgment is required to navigate potential conflicts of interest, maintain confidentiality, and advocate effectively for the client within the employment context. The correct approach represents best professional practice because it prioritizes a systematic, data-driven assessment of the employer's current engagement and collaboration strategies. This aligns with the ethical imperative to provide competent and evidence-based services. By evaluating existing practices against established benchmarks and identifying specific areas for improvement, the counselor can develop targeted interventions that enhance employer buy-in, improve communication channels, and ultimately lead to more sustainable employment outcomes for clients. This proactive and analytical approach ensures that interventions are relevant, effective, and ethically sound, respecting both client autonomy and employer responsibilities. An incorrect approach that focuses solely on the client's immediate needs without considering the employer's perspective or capacity would fail to address the systemic issues hindering collaboration. This could lead to unrealistic expectations, strained employer relationships, and ultimately, a higher risk of premature job loss. Ethically, this approach neglects the counselor's responsibility to facilitate a supportive work environment and may violate principles of informed consent if the employer is not adequately involved in the process. Another incorrect approach that involves unilaterally imposing solutions on the employer without prior consultation or assessment would disregard the employer's operational realities and legal rights. This could be seen as adversarial and unprofessional, potentially damaging the counselor's credibility and future opportunities for collaboration. Ethically, this approach breaches principles of respect for autonomy and may violate confidentiality if sensitive information is shared without proper authorization. A third incorrect approach that relies on anecdotal evidence or personal assumptions about employer willingness to collaborate, rather than objective assessment, lacks the rigor required for effective practice. This can lead to misdirected efforts and missed opportunities for genuine partnership. Ethically, this approach falls short of the standard of care expected from a certified professional who should be utilizing systematic methods to inform their practice. The professional decision-making process for similar situations should involve a thorough assessment of the current situation, including understanding the client's needs, the employer's context, and the existing relationship dynamics. This should be followed by a collaborative goal-setting process with both the client and, where appropriate, the employer. Interventions should be evidence-based and tailored to the specific circumstances, with ongoing monitoring and evaluation to ensure effectiveness and ethical adherence.